your club president has a fine hairdo as I do, so made me feel right at home and was very nice. So thank you, Faith. I appreciate the introduction. So thank you very much, and for the welcome to your club. It really is our pleasure to be here today. With me today is Dolores Hickman, and Dolores has been a team member at VITAS for what now?
I'm working on my 26th year.
26th year. So we're so happy to have Dolores on our team here in Ohio. She actually moved up from Florida and was a part of our Florida program. VITAS healthcare side is actually headquartered in Miami, Florida, and Dolores worked out of the Fort Lauderdale office before moving up to Columbus to be closer to family. And that's actually what brought me from Wisconsin to Ohio, was being closer to family. I have a brother that lives in Yellow Springs and my sister-in-law, and he's a professor in economics at Wittenberg, and she's a professor of psychology at Wright State. So got us a little closer to her. I have parents that live in Illinois, born and raised in Illinois, and then spent a number of years in Wisconsin. And I'm pleased to say that we are still in the hunt for a Big Ten title on the basketball side of the house. So I'm so sorry for anybody who's an Ohio State Buckeye fan. I can't imagine there's anybody a fan of that here, but I'm hoping for a good outcome in next week's tournament over in Indianapolis for the Badgers. We're pleased to be able to have the opportunity to speak with you today about VITAS and about hospice services. There's actually a connection that exists with VITAS and the Rotarian community. We have a chaplain in our program in Broward, Florida. John Nagana is his name, and he actually is from the Columbus area, and he worked at Nationwide Children's Hospital. And while he was there, he met Tom Davis, who is a part of the Rotary community here in the Columbus area. He's chief medical officer and former cardiac surgeon for pediatric cardiology at Nationwide. And John had been a chaplain there and became close friends with Tom. And John is originally from Kenya. And the Rotarians here in Metro Columbus area support the Rafiki House, which is a home that John began development of for children of, children without parents, actually, in Kenya. Kenya is a sub-Saharan African country that has really been ravaged by the AIDS and HIV crisis in sub-Saharan Africa. And there are many children that are without parents and without opportunity for education. And it is, I think, yet one of many examples that exist within the Rotarian community about you walking the walk and really supporting through service opportunities outside of yourselves to really help folks in need. And certainly I think John and the work that he's done in that school is a reflection of that. So John continues that service, and his personal work is being a chaplain in hospice, and then certainly you were supporting him through his work back in his home country of Kenya with the Rafiki House. Dolores' role with us is as a volunteer manager and bereavement manager. And in mentioning John and then in mentioning Dolores and her role as a volunteer manager and bereavement manager, we really get to the heart of what is hospice. Hospice is a really unique entity within the healthcare delivery model in that it was really founded initially upon a spirit of volunteerism. Going back to VITAS's origins back in 1978, actually, when the company really first began, our initial patient, Amy Philhauer, and the two persons that provided care to her, Hugh Westbrook and Esther Cauliflower, all really volunteered to come together and work with one another. It was an opportunity for Amy to receive care and service at home through a different model of care, meeting somebody where they were at end of life, rather than having that care be delivered in an institutional setting like a hospital. let's try something different and let's meet that person where they're at. So Amy wanted to be cared for at home, didn't want to die in a hospital, and wanted to be surrounded by friends and family and loved ones. And Hugh, with his background as a Methodist minister, and Esther with her background as an RN, were really seeking somebody that wanted to experience a different model of care. And the three of them came together, and out of kind of that initial experience grew a company that is now the nation's largest provider of hospice care and services. We have over 50 locations across the country, and we're in 30 plus states, and we have some 14,000 patients in service over those locations. Hospice